What has it meant for you now that you're back and you're back in your studies, and have you brought anything back with you?
I've brought a much broader knowledge of the Spanish language with me. I took a couple of classes here at UC Davis before I left, and I took 2 classes in high school and several before that. But I think the Mexico experience greatly facilitated my learning of Spanish, and I feel like I can functionally speak Spanish now between me and, say, a naturally born Spanish speaker.
And in terms of healthcare, medicine, or
So for
trying to
me,
decide?
there was one big change for me when I went down. When I went down, I had the idea that I wanted to be a neurosurgeon. And whenever I told people that, they'd always be surprised by that because it requires a lot of work to get up to that point. But when I went, I actually saw neurosurgery and several other surgeries. And the neurosurgeon surgery was fairly simple, and it took him about 15 minutes to do, and he was done. To me, it made the occurrence of surgery something that's more of a on-protocol basis, so that once you have a surgery, you know what you're going to do, what to look out for, and things like that. It doesn't provide much of an intellectual challenge as I would hope for it to, and so I decided to switch my own personal interest from being a surgeon, and especially a neurosurgeon, more to a clinician or a physician such as the ones I work beside in the emergency department now.
So basically, you went thinking you were going to be a very specialized kind of physician, and now you're thinking more about practicing primary care and family medicine. Would that be a
For me, I don't think primary care is right for me specifically, but something a little bit more specialized is that I definitely reduced my specialization desires.